Good day, everyone. Today I will present a comparative analysis of the tobacco control efforts in Colombia, Switzerland, and the United States. First, let's understand the scale of the issue. Tobacco use remains one of the leading preventable causes of the death globally, impacting 8 million of the lives each year. My analysis is based on the recent studies that highlights both success and ongoing challenges in tobacco control and across these three countries. Starting with Colombia, where tobacco use results in over 20,000 deaths annually and significant economic and environmental burdens. In Switzerland, despite the robust tobacco control measures, challenges is fully implemented FCTC, and young smoking rates persist. The United States has a rich history of tobacco control, yet disparities in smoking rates and the risk of new tobacco products pose ongoing challenges. In Colombia, despite high smoking-related mortality and cause, challenges like weak enforcement and policy gaps hinder effective and tobacco use reduction and environmental management. Switzerland has enact multiple tobacco control measures, yet struggle with fully implementing with the FCTC, managing young smoking rates and combating tobacco industry influence and undermine the public health. The United States, with a strong history of tobacco control, face disparities in smoking rates and challenges from the new products like the e-cigarettes. Colombia's universal coverage of the public health insurance system supports widespread access to health services, aiding tobacco control through smoking cessation programs. However, the effectiveness of these programs varies depending on how well they integrated. Switzerland's decentralized healthcare system requiring mandatory private insurance allows for extensive tobacco cessation programs. However, the occasional autonomy leads to a varied enforcement. The mix of U.S. health system features both private and public components, affecting uniform access to tobacco cessation programs due to system fragmentation. Comparison and contrast. All these three countries have universal or near universal health coverage frameworks. Difference. Colombia and Switzerland have more centralized approaches to health insurance, which could potentially facilitate more coordinated tobacco control efforts, while the US faces challenges with each fragmented system, leading to uneven implementation of the tobacco control policies. For Colombia enforced comprehensive tobacco control uniformly nationwide due to its centralized policy framework. For Switzerland, in Switzerland and decentralized system leads varied effectiveness of the tobacco control policies and across cantons. In the US tobacco control policies will significantly between states due to federalism, creating a patchwork of the regulations. In Colombia, socioeconomic disparities contribute to a higher smoking rates among the lower income groups. In Switzerland, despite better overall health care across and wealth, disparities persist between urban and rural areas and across socioeconomic classes, impacting the effectiveness of cessation programs. In the US, higher smoking rates among lower income and less educated groups are compounded by a targeted, adversing, and unequal healthcare access. Governmental structures influence the effectiveness of tobacco control, centralized in Colombia, decentralized in Switzerland, and fragmented in the US. To advance tobacco control, strategies should be emphasis global coordination and adherence and international guidelines, aiming to a consistent policies, enforcement, and innovative censorship programs tailored to a diverse populations. Reflecting on tobacco control in Colombia, Switzerland, and the United States, it is clear while all employee regulatory measures like smoke-free laws, their effectiveness varies due to a different healthcare access, policy enforcement, and socio-economic disparities. This highlights the need for approaches tailored to each country's unique circumstances to effectively reduce tobacco-related public health burdens. Here is the reference list. Thank you all for your attention. It's been a pleasure discussing these important issues with you today. Goodbye.